Hi, my name is Hans Palma, and I work as a business analyst for the Alliance for Health. We, along with the Healthcare Employers Council, have begun work on a new program called the Labor Planning and Forecasting Project. We've put together this slideshow so that you can be made aware of our work. This project is an effort to manage the West Michigan healthcare talent supply chain by 1. Forecasting the demand for the few occupations that make up 80% of the workforce, and 2. Developing and executing strategies to meet those demands. Let's start by talking about the forecasting side of this project. Those of you familiar with current economic forecasts might be wondering if another forecast really is necessary. We believe it is. The reason is because most of the data going into current forecasts are 3 years old. This means that organizations using these forecasts are basing their decisions on data from 2008. Fact of the matter is that we aren't in 2008 anymore. Can you imagine driving to work blind using only traffic data from 3 years ago? How about trying to steer an organization? It would not be much of a problem if that data were reasonably similar to today's, but this is not the case. If you go onto the Department of Labor and Economic Growth's website, you will find information that says that the licensed practical nurse and licensed vocational nurse occupation has a bright outlook. However, our employer contacts have all said the same thing. It's an occupation that is being phased out by the associate's degree nurse and the medical assistant. This is a huge problem considering that some students pay up to tens of thousands of dollars to become a licensed practical nurse. This is a very real problem, and this is something we want to solve with our forecast by giving reliable, up-to-date, employer-driven data.
So let's talk about how this forecast will work. For the first layer of this forecast, we will look at the supply and demand to and from the qualified labor pool, as defined by educators and employers. We will look at the number of students going through educational facilities and the number of jobs available at local health care facilities. We will forecast for the West Michigan region defined by 12 counties including Allegan, Ionia, Kent, Lake, Mason, Mecosta, Montcalm, Muskegon, Newaygo, Oceana, Osceola, and Ottawa. To begin, there needs to be an established baseline for this forecast. Because every organization grows organically, each gives its own titles to similar job codes. A good example is that a residential counselor at one facility may look more like a home health aide, but at another facility it may look like a psychiatric aide. These are two very different occupations with very different training requirements, illustrating the need for a consistent baseline to make the forecast accurate. In order to make this possible, we are using the ONET as our baseline. The ONET can be thought of as the Dewey Decimal System for occupations. Its SOC, or Standard Occupational Classification System, makes it possible to match an organization's job codes to a common job code family. This is not a conversion process, but a matching process. We decided to call it the HCEC Rosetta, after the ancient Rosetta Stone, and we've developed tools to make this process simple. Once the baseline is established using the Rosetta, we are able to gather data from educators on past and projected enrollment and graduate numbers. Working with educators, we will also estimate how many graduates are planning on entering the West Michigan labor pool. From employers, we will gather data on the total number of people within specific job codes, the hires and retires into and out of those codes, and the estimated change 3 months and 1 year out. Here are the 11 job codes being forecasted first. We have registered nurses, radiological technologists and technicians, pharmacy technicians, surgical technicians, licensed practical and licensed vocational nurses, home health aides, psychiatric aides, occupational therapists, assistants and aides, medical assistants, and personal and home care aides. The following slides are screenshots of the different tools we've developed for the data collection process. This one is a screenshot of a tool we developed to aid the Rosetta process. This one is designed for the home health aide occupation and includes sample job titles, a list of core tasks, and a list of supplemental tasks. This tool drastically simplifies the matching process. Here is a snapshot of the Rosetta report that employers fill out. This is a snapshot of the employer report. Currently we are using Excel as the data collection platform just because it's so universal and so versatile. Here's a sample of the past enrollment and graduate report that educators fill out. We have defined it by quarters to line up with the employer reports. Also, Not all educators participating have fall and spring divisions, so the quarterly divisions made sense. Finally, we have a snapshot here of the projected enrollment report for educators. After we have collected this information, we will be able to unbox a number of insights. We will be able to see how many qualified workers are entering the labor pool and how the pool is changing by occupation. We will be able to track the turnover and retirement rates within the labor pool and see how demand changes by occupation. We will also be able to analyze this by education and setting. We will be able to see which settings, examples being acute care, rehabilitation, long-term care, are growing or shrinking, and by how much. This will give valuable information to those who are guiding individuals into the healthcare field. After we have gathered the data, we will analyze it and develop a forecast. The regional forecast will be released for free to all stakeholders in the talent supply chain. This includes individuals in and interested in entering the labor pool, career coaches, health care and K-12 educators, job placement agencies, employers, and policymakers. The following slides are drafts of what kinds of data, charts, and graphs the forecast may contain. We plan to put the forecast online, in which you'll find a summary page similar to this chart right here. It will show an overview of the report. Interested parties will be able to see which occupations are growing, static, or shrinking. They will also be able to click links to connect them to educators and employers for these occupations. We also hope to show a number of other factors in this report, including growth by setting. This will be helpful in exposing individuals to the different healthcare settings available to them. Often students gravitate toward a few settings, but exposing them to all settings will help direct them toward those settings that are growing but may not be as well known. We anticipate the regional forecast will provide us with insights into how well educators are meeting employer demand. Here you see 4 different scenarios of what the data could show in regards to enrollment into specific health professional programs, graduates from those programs, those graduates entering the West Michigan labor pool, and the employer demand for those professions. In scenario 1, we would see that the West Michigan area is educating enough students to meet employer demands. In scenario 2, the data demonstrate 2 problems: low graduation rates and that too many students were entering the West Michigan labor pool. Educators could take this information and choose to do several things. They could downsize current programs, or they could inform their students of the fact that students should plan to look outside the West Michigan labor pool for occupations. Should scenario 4 occur, West Michigan would be experiencing a labor shortage. However, it would illustrate that while we are producing enough workers, we're not retaining them within the West Michigan workforce, and thereby have a shortage. Employers could take this information and work collaboratively to encourage students to stay within the region. Many other scenarios are possible, but these 4 illustrate how useful this forecast will be. One of the most important factors of this forecast is that it becomes more useful over time. In the long term, the regional forecast could give us insight into certain trends. In this instance, we see a decrease in enrollment over the course of 3 years, while demand for workers remains steady. We would be able to forecast the possibility that in the 4th year, we would experience a shortage. With this information, employers and educators could take steps to avoid this problem. We have just completed looking at the regional reports. Next, we will look at organization-specific reports that will be given to participating employers. In addition to the regional report, each contributing employer will receive an individualized organizational report which will analyze data from the organization against itself and against the region. In this potential analysis, we will be able to compare projected growth versus actual growth. In this case, the organization would see that it is consistently overestimating its growth for a certain occupation. This information would be useful for strategic planning and the allocation of resources. As we said earlier, this forecast becomes more useful with time. Over time, we would be able to compare hires, retires growth over the period of several years. In this scenario, we can see a seasonal pattern arising. This would enable employers to plan more intensive marketing and hiring for certain positions at certain seasons. Finally, it would be possible to compare an organization's data with its peer group and the West Michigan region. In this case, we see Organization A's turnover and growth for a given occupation, compared with that of its peer group and the region. All this is possible with the very little data we are asking employers and educators to supply. As we look to the future of this project, we should talk about its long-term goals. One goal is to forecast those few occupations that make up 80% of all healthcare jobs. 11 job codes have been selected for this first phase. 10 more occupations will be added to the forecast once educators and employers have been surveyed regarding which 10 they believe should be added. Additionally, through this project, we also seek to maintain stakeholder communication. Specifically, we want to know from employers where the jobs are and where they're not, what certificates and experiences are essential to certain occupations, and what knowledge, skills, and abilities are candidates missing. In many ways, we see this forecast as a gateway to collaboration between employers and educators. We've been talking with a number of educators and employers, and something that keeps coming up is someone will say, well, we try to reach out to the other side, we try to talk, and we try to tell them what's going on, but they don't listen. This is happening on both the educator and the employer side. The reason we believe this is happening is because there's no unified employer voice. We see this forecast as an opportunity to bring the employer voice together to say, this is what our needs are, please respond. And we think this will be the key to effective employer-educator collaboration for the future. There is one final point that we should touch on before we close the discussion on the forecast. That is the question of financial feasibility. This project is financially feasible for all employers to participate in. There is no external cost to the report. The Healthcare Employers Council and the Alliance for Health do not charge for the forecasting work. The only cost is the internal cost of gathering the data. This comes down to time. All in all, this should take but a few hours. The maximum reporting time for the first year would be less than 24 hours. Now compare that with the amount of time it takes to hire a single healthcare professional. Consider the amount of time it takes to contact them, to do phone and face interviews, and to go through the onboarding process. There have been several estimates about how much it costs to hire healthcare professionals. That ranges between $17,000 and $64,000 for a single nurse. Technical staff can be $2,000 to $5,500. So when you consider it, if this project only helps each organization retain one staff member for 1 year, it's completely paid itself. But as you've seen, we expect this forecast will do so much more. It will give valuable insight into the composition and quality of the labor pool. It will provide educators with the data necessary to convince policymakers to allow for program expansion. It will help prevent market shortages and market flooding, give employers information that will aid in strategic planning. Most importantly, it will help improve healthcare for the entire West Michigan region. So there's an introduction to the forecasting side of the Labor Planning and Forecasting Project. If you or anyone you know would be interested in participating in this project, please contact Hans Palma at afh.org.